Good morning from Hong Kong. As the Executive Director of Asia Society Hong Kong Center, I am Alice Mong. I'm delighted to welcome our audience to episode 18 of the Coronavirus Update. And believe it or not, it's been episode 18. We started this exercise in February of this year, and 18 episodes later, we are really honored to have Professor Ivan Hong, Professor of Medicine, LKS Faculty of Medicine at the University of Hong Kong, and also honorary consultant, Queen Mary Hospital, with us today. We're going to have a shortened interview today. By instead of an hour, we'll have 45 minutes. So we're going to get started almost right away. But before we get started with my conversation with Professor Hong, Dr. Hong, I just want to put something in context. Did some research last night. Since we started the conversation in February, at that time, Hong Kong's number was around 69 in terms of infection. Singapore was around 85. And worldwide, the number was around, was quite low, was only around 83,000. And the US at that time, in February, only had 16 cases. Fast forward, June 30th, the numbers are quite different. In Hong Kong, we're still relatively low at 1,204, I believe, as of today. And about, unfortunately, Singapore has skyrocketed to 40,000, and we have witnessed the 10 million milestone in terms of global infection with 500,000 deaths globally. And U.S., 2.5 million, 25% of COVID is in the United States, 25% in Europe. And here in Asia, we've been very fortunate with only about 9%. So today, we want to talk about really lessons from Hong Kong. And one of the reasons we started this conversation in the beginning was very much about Hong Kong. And in the 18 episodes that we've done, I've calculated about a third of our speakers have been Hong Kong professors and researchers and medical professionals. So we're really delighted today to have Professor Hong with us to talk about, lessons from Hong Kong. And in terms of what have we learned, we need to congratulate ourselves a little bit, but at the same time also not be complacent. So I think Professor Hong's background, very much started with SARS in 2002 is when he started his career. So with this conversation, we really want to talk about Hong Kong's, what are some of the lessons that Hong Kong can share with the rest of the world, because our number, despite all of the other numbers, are still relatively low, only with 7 deaths. Unfortunately, last week we've had the 7th death. So Professor Hong, tell us about your experience in terms of this COVID-19 and just kind of lessons from Hong Kong that you wish to share with the rest of the world.
Good morning, Alice, and good morning to you all. It's really my pleasure to be here. We turn back the clock to 2003, when we were having SARS at that time. Our experience is very much different from the COVID-19, because at that time, everything was really unknown. As in early Feb, in 2003, we only know that there was some kind of outbreak in the Guangdong province in the late 2002, and that is causing severe pneumonia, and there are people actually dying from it. And it's not until probably talking about late March, April, when we have our first case in Hong Kong, that we were subsequently able to identify and isolate the virus to be coronavirus. Unfortunately, at that time, there were no any kind of hardware in terms of negative pressure facilities. There were no treatment for SARS, coronavirus at that time. And the only thing that could do is you could just cohort everyone, all the confirmed patients, in a general medical ward without negative pressure. And we went in fact, every day we spent 3-4 hours in the general medical ward, with an N95 mask, not even a face shield, no PPE, just a gown that is washable to see and look after these patients. And we, of course, we go through all the X-rays and not even CT probably, but we have no weapon. We only have things like steroids or ribavirin, which is a very weak agent against coronavirus. And we just have a finger crossed, and probably about 1/3 of our patients ending up in the ICU, and that was 2003. But since then, we have learned our experience that we were obviously we were much more well prepared for this time, because we have, first of all, more than 1,000 beds in the isolation negative pressure facilities. We have all the diagnostic ready. Once we're able to sequence the virus, it was given by the Chinese CDC in early Jan and share on the WHO. We have our rapid test, the RT-PCR testing for all our patients. We also have all the PPEs. We have stock for more than a month. We have N95 masks. We have face shield. And in fact, when you go into the isolation ward, when you confirm the case, we isolate all the confirmed cases, and then we would diagnose very promptly, and then we treat them straight away. And we also have antiviral ready, which has been tested in vitro in the lab, showing that it's actually work. And also we have agents that actually work against the SARS coronavirus 2003. So we use these antiviral, which is like a repurposing drugs, which is used for treatment of other viruses or other kind of infection or disease. These agents, for example, the interferon beta 1b, the ribavirin, the Kaletra, which is all ready, which we can use to treat against the COVID-19. So we very much have everything ready to fight for this pandemic.
So one of the questions I've been yesterday talking to some friends, I was telling them I was going to be speaking to you, and these are mostly expatriate friends from all over the world, and they were commenting on Hong Kong's very low number of death rates, 7. I mean, that has to be one of the lowest in the world. And so can you then talk about, the lessons learned from 2003 in terms of the cocktail treatment? I mean, and considering Hong Kong also has a large elderly population, and the way we've been able to handle it with, unfortunately number 7 was just last week, but still, how have we been so effective in handling? I mean, sure, the numbers are low globally, yes, from only about 1,200 right now, but still the low death rate has been something that I think people have all over the world have wondered about. How did we achieve that number?
Well, these were actually based on experience in 2003, when towards the end of the 2003, we were using, we've been testing in the cell line in the lab, and also we were using the Kaletra, which is the polymerase ritonavir, which we use, protease inhibitors, which we use to treatment of HIV. And we were also using ribavirin, which has a weak action against the SARS coronavirus, but when you combine together with the Kaletra, it actually works very well. Mm-hmm. When we treat SARS patient 2003 with these two agents, we find that they have a lower mortality rate and lower complication rate of so-called pneumonitis or severe respiratory failure when we compare to a historical control. So, and then subsequently, of course, there's the emergence of MERS about 10 years ago. We were actually using, testing the interferon beta 1b and also Kaletra in a marmoset, which is a South American monkey model, macaque models. And again, we find that by using interferon beta 1b, or that we were using the Kaletra, we were able to reduce the mortality in the monkey model and reducing the inflammation inside the lung of this monkey model. And as a result, right in January, Professor K.Y. Yun and myself, we already designed that we were going to use a combination of drugs of using the interferon beta 1b, as well as the Kaletra and also the ribavirin as a triple combination to treat patients who will have confirmed to have COVID-19. But the most important thing is not only using a combination of antiviral that has moderate action against the COVID-19, which again we have tested in the lab after we have had the COVID-19, the SARS coronavirus 2 sample. Important thing is the early treatment, that we start the treatment very early on in the first week when patients presented to us. This is a very simple concept as you are treating like influenza or you're treating any kind of respiratory viruses. If you can intervene and suppress the viral load or the viral replication right in the first week, when the patient presents to you. Similar when you treat influenza with Tamiflu or Baloxavir, within the first 48 hours is the best. So by suppressing the viral load right from the beginning, you will be able to prevent any kind of complications in the second week, which is a lot of cytokine or inflammatory reactions that we know will happen in both SARS 2003 and also in the influenza patient. And by doing so, you're able to reduce the number of complications as well as the number of mortality, especially in elderly patients or patients with comorbidity like diabetes or coronary artery disease. And we treat everyone, regardless whether they are, initially they were symptomatic, but now we're treating asymptomatic patients too, because that we do not know, simply do not know who is going to develop the complication in the second week.
Well, short of getting the vaccine, which is still probably a year or so away, I think from one of our conversation earlier, it's like before getting the vaccine, the drug cocktail you mentioned, it seems like a lot of the countries of the world are also adapting it. And also, it's nothing new. My understanding, having talked to Professor Dr. David Ho, who's famous for the HIV, the AIDS cocktail, the treating AIDS, and there's no vaccine yet for AIDS, but he has been, or the HIV community, those with HIV have been successfully treated by drugs cocktail. And it sounds like what you and Professor N is doing here in Hong Kong, we obviously have been successful, or else the mortality rate wouldn't have been so low. So that's something that I think is also a lesson of Hong Kong. But I think unlike, like other people, we also have the PPE issue. I think initially, as I recall, in February when we started this conversation, I think the mask question and PPE for the one of the things I remember talking to Professor Cowling about was there was not enough masks at that time in February, and PPE shortage here in Hong Kong. And part of the problem was also sourcing from China. And also, unfortunately, at that time, too, we also had the the workers, the health worker going on strike for a short period of time. And also, I remember there were also public protests about no quarantine hospital near where people live. And it seems like we've been fast forward 4.5 months later, we've conquered some of these issues, but the PPE issue is still something that seems like other parts of the world are still addressing, along as there is, it's needed. But in terms of, you talked about earlier about SARS, there weren't any, and you guys were really, the frontline workers were just, and in fact, there were a lot of deaths, unfortunately, the medical professionals. So kind of talk about that experience. And I understand you also, in one of the interview, mentioned that you could not see your parents or your many of your elderly relative for several months. So that experience obviously has helped in terms of this experience. And now the government, another things we've done right has been the containment issue, and also I think the two things I remember, containment and slowing down the transmission. It's also areas where Hong Kong have done well. Do you want to elaborate on that? I mean, again, lessons learned. I think in the rest of the world, especially in the United States, they're still fighting about masks, which I find quite ridiculous. But just kind of, would you give? What kind of grade would you give Hong Kong on that in terms of containment and the slowdown of transmission?
Well, I think if you wanted me to give a grade, we're probably around 8 out of 10 in terms of blocking of transmissions and protection for the healthcare workers. Of course, at the very, very beginning, in Jan, we already noticed that there's a pandemic coming our way. And of course, we were looking at our stock, and we find that, of course, we had like a month's supply of stock for all the PPE, including the N95, which we were thinking probably not sufficient. But when we look back, when we're now looking at globally, we find that in fact our storage has been quite sufficient compared to the others, much better, because the others probably won't have like less than a week's supply. And of course, at that time, we were already looking for and buying all these PPE equipment and also the masks from the rest of the other parts of the world where they do not have pandemic at that time. So we were stocking up at that time. But I think the most important thing, as we learned from 2003, is the subsequent setting up of the negative pressure isolation facilities. That is probably the main protection for the healthcare workers. Because we find that once the patient is put in the negative pressure room, we actually did study. Dr. Vincent Zhang, who is my very close friend and collaborators in Queen Mary Hospital, he actually, he is the infection control officer, and he was testing and sampling taking environmental sample, and found that there was close to zero contamination once the patient was put in the isolation facilities. So in other words, if you go into the each isolation room, if you're wearing your N95 mask together with your face shield and the PPE, you are very, very well protected. And we're saying that, in fact, you don't need to change your N95 mask and the face shield after going in. You probably only need to take off your PPE, change your PPE, and then you can go into the other room. Because, in fact, if you take off your mask, it's probably the highest risk of all. So you can actually go around and see all the patients inside the isolation ward before you actually need to change to a new N95 mask. And by saving on these, you're actually able to keep the stock in terms of masks and also the PPE. So the main thing that I find out is probably the negative pressure isolation facilities, which is probably most important in terms of preventing the healthcare workers from getting the COVID-19.
So now I want to turn in to talk about kind of the worst case scenario. I think we've been so, in some ways, patting ourselves on the back, and I think it's Hong Kong really deserved to acknowledge our success in fighting it so far. But I guess my concern now would be, I want to talk about the kind of the hospital authority, and just in terms of, I remember when we in March or earlier, I mentioned the Singapore number, and in February our numbers were very similar to Singapore. Yes. But then all of a sudden they really, really spiked. And I wanted to talk about the lessons learned from Singapore, because if we were to have any type of spike like this, and recently last week or so, we heard about the spikes. Beijing also have quite a few cases. New Zealand had announced that there was none, and now there's also some resurgence, and Australia too. So for us in Hong Kong, I mean, let's not, we are still very close. We're at border of China. So what if worst case scenario that let's say the border reopens, and even now with the transit, people, the cases that are coming in are from the outside, and currently I think it's been 16 days yes. that we have not had a local transmission. But what if there's a worst case scenario? And I did not realize, you mentioned the isolation beds. We only have about 1,200. Right, around that number. And, in Singapore's case, I think in one day, I think they spiked up to 1,400 or something in that kind of thing. And so I guess my concern is, are we ready if we were to have a spike like that? And how can we address it? I know in the U.S., seeing New York, where I used to live, I think the government set up, temporary hospitals in the park, in Central Park and all that. So how can Hong Kong deal with that if there was to have a kind of a sudden spike? Do we have enough of the isolation beds?
Well, I think the most important thing perhaps that we are able to keep the number so low, apart from having the isolation facilities as well as the diagnostic and treatment, it is probably the universal masking that the entire population is very compliant to. And that is probably one of the reasons why we're having such a low number of cases, that, if we are able to continue with the universal masking. But in order to keep the numbers down, I think most important perhaps is first of all, of course, is the border control, that we have a sufficient diagnostic. And of course, we are now using the saliva testing which has been one of the diagnostic that have been developed or promoted by my collaborators, Dr. Kelvin To from our Department of Microbiology. And he's been using the saliva testing for the past few years. And the important, of course, is having the saliva test is that it doesn't require any healthcare workers. You just give a bottle to a sample bottle to the individual, and he can provide the sample with you. And as long as they provide a sufficient sample, like 5 to 10 spits, in sufficient volume, without prior rinsing the mouth and drinking water, then the sensitivity will be just as good as that of like a nasal swab or throat swab. So if you're able to provide sufficient diagnostic, and that we can promptly make a diagnosis and isolate and treat everyone in the isolation facilities, as well as quarantine or centralized quarantine for any of these contact cases, then we will be able to keep the numbers down.
So then the question I have now is about testing. In the United States, I think President Trump has said the number went up and he says stop testing, right? But here in Hong Kong, I've been curious, and I even spoke to my doctor about this, is to test or not to test? Some of us, I remember in January actually, around Chinese New Year, having a cold around the height of, when we were hearing about the virus. And so in some ways I don't want to know, but in some ways I do want to know. Yes. So right now I know a lot of people here in Hong Kong, friends, I'm talking to friends, is like to test or not to test. Before they said, if you have symptoms, fevers and stuff, definitely to test. But now I guess the question is really about the herd immunity. We've been so lucky, and so do we need to know about, Hong Kong's numbers? I mean, my understanding is we've only tested, about 185, we have a population of almost 8 million. Yes. So should we be testing more? Because I understand in Beijing, even last year, they really ramped up the tests, and China can do that quite quickly. But here in Hong Kong, I guess the question is to test or not to test. And like you said, some of the testing does not require medical professionals to do it. But are we ready, and can we take, do we have the capacity now to really ramp up the tests? And my understanding, some tests are actually the cost is covered by the government are quite low. And there are two type of tests, the antigen and the two type of tests. And when people come into Hong Kong now, they also are tested. So I guess the question for us here in Hong Kong now is to test or not to test.
Well, there are two types of tests. The first one, of course, is the RT-PCR, which is the rapid diagnostic testing by checking the RNA level, which is probably the most sensitive, as well as that if you have a recent infection, that is the way to test it. The other way, of course, is checking the blood, the serology, the antibody, which unfortunately not that diagnostic, especially for the first 10 days, because we know that the antibody only reached and plateau by about 10 days from symptom onset. So you will miss probably half of the cases if you use serology as diagnostic. So the RT-PCR is still the most important test to confirm recent infection. In terms of testing, we believe that we should be offering more testing. Currently, probably we are running around maybe 3,000–4,000 a day. But I think that it's important that the general population have an easy access to the diagnostic test. And it's likely to be a collaboration between the public and the private sector. Because simply probably the public health lab, of course they should be probably doing a little bit more testing, but in terms of capacity, they have a really, a maximum capacity, just covering all the hospitals as well as that in the border control. And of course, hospital authority has been partnering very closely with the Department of Health in terms of diagnostic. But I think the role is probably will be on the private, collaboration with the private to offer more tests, which is now becoming quite widely available to most of the outpatient clinic in most of the private hospitals, and they're able to do a rapid test, probably with the result coming back within like 8 to 12 hours.
Can you, now, you mentioned the partnership, the public hospital and the private hospital. Hong Kong is very unique in that way, in terms of, I know now all of the COVID-19 patients are going to the public hospital for treatment and so on, and the private hospital is kind of taking up more of the other type of medical treatment and so on. But are you happy? I mean, can you just kind of, you also studied in UK and all the, and we've heard about the NHS in UK also in terms of how they are dealing with it. So I guess I'm interested in like comparing and contrasting. What are some of the areas where Hong Kong is doing right in terms of the partnership, the public-private, and comparing to maybe what's happening in UK, where you're familiar with? U.S. is definitely a total system. U.S. I'm more familiar with, having lived in the U.S. but it is, and also ups and downs of the U.S. we've seen as well. So I was wondering if you can generally, from a medical professional, from you, what you've seen, kind of compare and contrast in this area in terms of the Hong Kong's unique public-private hospital partnership. Is that something other people can learn, or do we still also have areas that we can modify and improve?
Well, I think the private-public partnership in Hong Kong for medical care is very unique because we have probably around like 75-80% of the population being looked after by the public, and that the 20% was being looked after by the private. The most important thing, of course, is that the private hospital, unfortunately, they do not have the negative pressure isolation facilities. And as a result, all the COVID-19 patients are now being taken care by the public sector, which I think is the right thing to do. But in terms of the partnership, I think it's important that if the private probably could offer is in terms of diagnostic, and then if they can take up part of the diagnostic, and once the patient has confirmed to be having COVID-19, then the patient could be transferred to the public hospital to be treated. And as well as the other thing, of course, is that then the other patients who are non-COVID-19, especially when the number of cases has been increasing, then of course the partnership could work in the sense that patients with other diseases, especially non-infectious, then could be taken care by the private sector. And of course, this could be funded by the government and that, or by the ASHK, so that the beds could be more accessible and could be properly utilized in a pandemic situation.
It's interesting you mentioned. I have my sister-in-law is an ICU nurse in the U.S., and my understanding is, I think they kind of learned also from Hong Kong and other parts of the world. They early on designated their hospital as the COVID hospital, so that yes, all of the patients are routed there. And in fact, yesterday I also heard a story about now some of the COVID patients in Japan can receive visitors, but they can't in terms of entry. Has to go through another route, almost like a fire escape, to see the patient who is recovering. So obviously, there are things, logistics that I think in Hong Kong, maybe because of SARS and this, we've kind of dealt, yes, made a very interesting. I can think this is really a really interesting experience that I think a lot of that we can share with the world. I have a feeling even now, as we continue with the COVID, that I think, and I'm sure these lessons are being shared globally. I hope it is, because I think the success of Hong Kong really needs to be applauded. So now I want to, we only have about 15 minutes left. I thank you so much from taking time from your busy schedule to speak with us. So I want to ask on behalf of our online audience some of the questions. This question is interesting. Do you think if it's possible for Hong Kong people to go mask-free in the near future? And when will that be?
Well, unfortunately, it won't be a very near future. I think the universal masking still have to go on until we have an effective vaccine. And hopefully that is not too far away, because most of the vaccine trial have already now entering into the phase 1. Then some of these studies, some of the early phase 1 trial have already completed, and a few trials from China has already been published and show that it's actually working pretty well. And of course, we, in terms of the HKU vaccine, we will probably, hopefully, be entering in phase 1 later on this year. And I think, provided that the phase 2 trial go on successfully and that we have the antibodies sufficiently high, and that we will be going into manufacturing. So finger crossed that probably about 18 months away, we'll have an effective vaccine. But unfortunately, during this 18 months, then I think we will still have to wear masks, especially indoors when you are in close contact. The other thing, of course, is that universal masking help is that there is also a really severe drop in terms of other respiratory viral infection, especially influenza, during the peak season, which we have found that there's a drop by 80–90% in terms of the influenza cases. So I guess you can go mask-free when there's an effective vaccine, but I think in winter, it will still advise you to wear masks, not only to protect against COVID-19, but also to protect you against influenza and other respiratory viruses.
And that is, the influenza is a really interesting question. I remember watching the news, and during the flu season here in Hong Kong, the hospital beds or the hospitals are very much inundated with flu patients, and there is not enough beds. And they've, one of the description that I read is they even have to put people under various areas in hospitals. It's just there's not enough room. So I think in some ways, lessons learned from this COVID-19 in that if you wear the mask, there's less flu. So I think that is something I used to, when I traveled to Japan, always admire people in wearing the mask in the subways and so on. And now I understand why. I think, and I have to say I'm a total convert, considering 6 months ago I was quite skeptical, like a lot of people in the United States, which I wish they would be converted. But that's another story. But one of the questions from our online audience, it says, how effective is the recently developed triple therapy on COVID-19? Is it possible to totally suppress the virus in the future?
Yes, it's a very good question. In fact, if you look at the paper that we published in The Lancet, and we find that the triple therapy, especially most important perhaps is the interferon beta-1b, which is the backbone of the triple therapy. In patients who were using this triple therapy, the viral load was actually turned negative in terms of the nasopharyngeal sample and also the flow saliva and the flow swab and in the stool much quicker, significantly shorter compared to just those using just the Kaletra single therapy. And it was like 5 compared to 7 days for NPS. And as a result, the patients clinically also improved much quicker compared to that of using just a single drug. So we know that the viral load suppression is very good and very effective. And of course, we have no mortality in that cohort. But of course, the limitation in that study is that we have very few severe cases, probably as a result because we treat them very early on and we're able to suppress the viral load very quickly, and hence very few patients actually develop complication requiring intensive care or ventilatory support, or none, in fact, require dialysis or ECMO support in those 127 patients. So, of course, we're now exploring with our very limited number of severe cases whether this triple therapy also work in severe cases. But at the same time, we are also looking for other treatment antiviral therapy that can combine with interferon, but with fewer so-called diarrhea side effects, because the Kaletra will give you diarrhea and also nausea. So by using this combination, hopefully we'll be having an even more effective treatment therapy in suppressing the viral load much quicker hopefully within like a few days, then the patient could already be, they can go home and they could be discharged. And of course, we're looking for ways that in case there's a massive outbreak, that these treatment could even be given at outpatient or even at home with home quarantine.
Okay. This question asks about a flu virus with pandemic potential was recently found in China. I think, is it the swine flu? Or I just remember reading something as well. What is your view on that, and what precautions people can take to prevent another outbreak?
Well, I think after all, the most important thing is to, first of all, avoid any kind of, unnecessary contact with wild animals. Especially should stop any kind of wild animal or live animal selling or caging them together or consumption even as a delicacy, eating wild animals. By stopping the close contact with wild animals and also with wild birds, you are able to prevent the any kind of jumping of these kind of coronavirus which are present in bats to human, and also just as birds, many of these avian flu from jumping and mutating and into the human species. So simply by doing that, you were able to prevent the next kind of wave of pandemic. Of course, there are certain extent sometimes that if you have an antigenic shift in terms of the human influenza, then you can't prevent this from happening, even if you stop contacting birds or wild animals. But simply by reducing the frequency of contact with wild animals, I think we will be able to prevent another pandemic from happening.
There are two questions here about Hong Kong hospitals. In how have Hong Kong hospitals cope with COVID-19? And the other question is really about Queen Mary Hospital. How is the sentiment in Queen Mary Hospital among the doctors and nurses? Can you comment on that?
Well, I think in terms of sentiments, is of course in the early Jan when we first heard of the pandemic, the frontline doctors, especially the young doctors and nurses who did not have the experience in SARS 2003, was very, they were very cautious. They were very, some of them even expressed reluctance of going into the isolation facilities. And we understand their feelings because they simply do not have that experience that we have in 2003. And I think one way of demonstrating or convincing them it is safe to go in is as a division chief in ID, and of course together with my department head and chief of service, Professor C.S. Lau, and also my ex-chief, Professor Albalai, we actually volunteer. We went in to the isolation ward first, and I did that by demonstrating, by going in every day to the isolation ward, taking history, examining the patient, taking blood, doing sampling, doing a nasal swab, taking saliva sampling from the patient. And I think simply by going in to these and doing frontline work and demonstrating and showing that this is safe to go in is the best way to convince them to go into the isolation facilities. And of course, with time and also with an effective antiviral treatment, our frontline staff gradually, they know that it's safe to go in. And of course, we have my trainee and some of the junior staff was volunteering right from the beginning. And of course, I'm very grateful to both the doctors and the nurses who went in and fight a battle with us.
Well, I wanted to kind of share a personal observation because is that the Hong Kong doctors here have been so brave, but they haven't seemed to be getting the kind of recognition. The medical professionals, and this is my own because having seen the coverage and also my own story of my sister-in-law who's in fact, my brother is telling me because she was an ICU nurse, the ICU hospital, for many weeks, they were free food from the community sent to these frontline doctors and nurses. And we've seen in New York the appreciation, regular applauding the frontline workers in New York City, where I used to live. And here in Hong Kong, I just kind of get the sense that and there has been these campaigns, applaud, but I have to say there hasn't been that much of appreciation of our own medical professionals here in Hong Kong, despite the numbers, the success that we've been treating it. I mean, and this is my own personal observation. I've talked to my colleagues here about it, and I just really want to kind of use this opportunity to really, again, thank yourself and the medical professionals in Hong Kong for the wonderful work that you have all done, and from day one. Yes, I think some of the younger doctors, some of the people who have no experience might be a bit nervous about it, but I remember speaking to, I believe it's Dr. Stephen Lam, also saying he was volunteering himself, because he himself had also some experience. So I've heard these stories here in Hong Kong personally and just from anecdotally, and I just feel it is something we have not here in Hong Kong share our appreciation in terms of the way that in Europe the medical professional as well as in the U.S. Has been getting. So I think on behalf of Hong Kong people, or just from my personal perspective, I want to thank you all and thank you personally for being here and sharing kind of the experience. I think this has been a very difficult year as for all of us here in Hong Kong, first with the protests and now with COVID. But I do see a light at the end of the tunnel. I think you talked about vaccine that Hong Kong is working on. And I also hear the successes of the drug treatments. And experience counts, considering we've only had 17 years. And you yourself have been, 20 years, less than 20 years
yes, indeed.
in this area. And you've, in terms of the accomplishments that we here in Hong Kong, and congratulate you personally. I really do think this is one of the reasons we started this conversation in the beginning, to learn more. And I have to say, every time I talk to professionals like yourself, I feel so much better afterward. And I think this is an area where I think in Hong Kong, we really have to pat ourselves on the back and thank our medical professionals, doctors and nurses, frontline health workers for the dedication they have given and sacrifice, and sometimes not seeing their families for a long time. So on that note, I want to thank you for being here today, and thank our audience for joining us, and then the global audience. I hope you've learned from this, and I know this is not over. We still are hearing spikes throughout, whether it's in Europe or the U.S., unfortunately, with the 4th of July holiday coming up. I hope everybody will be wearing their mask. That's all I can say. But again, thank you, and Dr. Hong, for being here and sharing your expertise with us. And we look forward to welcoming you back when maybe the more groundbreaking work is done, and having our further conversation. I think we really do here in Hong Kong need to share some of our successes. And I think a bit of announcement. Episode 19 will be July 29th, and we are really delighted to have Professor Dr. ASHK Jha, the new Dean of Brown University School of Public Health. He'll be joining Brown University in September of 2020. And Dr. Jha, last time we had him, he was at the T.H. Chen School of Public Health in Harvard. So we're really delighted to have Professor Jha with us July 29th. So stay tuned for episode 19. And I know my colleague is working on an episode on those who have recovered, whether locally or globally, from COVID, and that will be coming to Asia Society Hong Kong in the near future. And again, I want to thank all of you for joining us today on episode 18. And again, my profound thanks to Professor Ivan Hong for being with us. And enjoy the rest of the day and wear your mask. That's all I can say. Thank you so much for being with us.